quarter two. So firstly, hello and welcome everyone to the New to Q webinar. So I'm Matthew Hill, I'm the Insight Evaluation and Research Manager within the Q team. So that includes kind of managing both internal and external evaluation of Q. And actually we've just come into the end of a big 4-year external evaluation undertaken by RAND Europe. Just got the final report for that yesterday actually, so we'll be publishing that widely over the next few months. And as well as kind of leading the evaluation, I'm also, my role is thinking about how we really draw on the kind of collective insight within the Q community and partly move that kind of insight around within the community, but also use that to kind of inform and influence kind of wider policy and practice around improvement. And finally, I also sit on the leadership team for Q. So we're really delighted to have you all here. I know it's in slightly kind of strange times, and we understand that everyone will be under a lot of increased demand and increased pressure. So we know it's a little bit strange, but I think, you know, it's great to have everyone here, and we've got this 45 minutes, haven't we? And I think we can afford ourselves, hopefully, a bit of space just to allow ourselves to kind of welcome and orientate ourselves to the Q community. A few kind of technical bits before we get started. So I usually say people might not be that familiar with Zoom, although I'm guessing people have got a lot more familiar with it maybe over the last few weeks. If you do have any technical issues, do just type them into the chat function, and myself or Robin, who's my colleague from the comms team who's joining us, will try and resolve those. It can be easy, although the background noise sounds fine at the moment, if everyone who's not speaking mutes themselves. That just makes everything a bit clearer. Just obviously make sure that you remember to unmute yourself if you do want to say something. And yeah, you can kind of chip in by unmuting yourself. Otherwise, you can also put in kind of comments and questions as we go in the chat function. So a few people have been introducing themselves in there, so you can kind of say hello to make sure it's all working. And like I say, any kind of questions or comments, do just kind of drop them in there, and we will return to them kind of periodically and try and cover as many as we can. And then the final thing to say is that the webinar is being recorded. So that's obviously for those people who haven't been able to join, but we will share it with them after as a point of reference, but so they can kind of listen back to it at their pleasure. Okay. Great. Hopefully everyone can see the slides now. So the plan for the session, like I said, we've got 45 minutes, and it really is just quite an informal opportunity to kind of welcome everyone and orientate you to Q. We'll find out who's in the room. Really excitingly, we'll hear from a couple of other members who are kind of existing members about how they've been involved and their experience of Q. So I'll be handing over to them soon. And then, yeah, I'll just take you through the various kind of activities, resources and offers within Q so that you're clear how you can kind of make the most of it. And like I say, there'll be plenty of opportunities for questions and discussions throughout. So like I say, I'm Matthew, I'm the chair, you can see me there. I am smiling, although I look a little bit unwell based on the colour, but I can assure you I am fine. And like I say, we're delighted to be joined by Andrew Parker and Nikki Davey, who are going to share a bit of their experience of being members so far. Actually, we'll come back to them in a few minutes, but I will just ask Andrew and Nikki to introduce themselves briefly. So Nikki, do you want to kick off?
Just finding the unmute toggle. So apologies for that. Yeah, hi, I'm Nikki Davey. I'm a quality improvement practitioner and coach. I've been with Q almost since its inception, so I'll be sharing with you a bit of that journey with you today. So really pleased to see everyone on here. It's great.
Great, thanks, Nikki. And Andrew, do you just want to say hello and introduce yourself?
Hi everyone, my name's Andrew Parker. I'm Clinical Governance Manager and paramedic by background with the Scottish Ambulance Service, and I joined Q in 2017.
Fantastic, and like I say, we'll be hearing more from Andrew and Nikki soon. So the first thing to say is just a huge kind of welcome to the community. You know, we are really pleased and excited to have you all kind of amongst our number. Q's obviously grown pretty substantially now since it was set up. So there was just a few hundred in the initial kind of cohort, that some of which you can see there on your screen. We're now kind of knocking on the door of 4,000 members, and we'll be looking to grow that kind of, steadily over the next few years. We're funded by the Health Foundation, as well as our country partners within England, NHS England, Health Improvement Scotland, Public Health Wales, and the Public Health Agency in Northern Ireland. And we're also really pleased to be expanding into Ireland itself over the next few months. So that's really exciting. I guess we do a lot of different things within the kind of Q community, but the aim is quite simple, really. So we're here to support people in their existing improvement work, trying to set up an infrastructure and a range of kind of offers and resources that make it easier for people to share ideas, enhance and learn skills and knowledge, and collaborate to make changes that ultimately benefit patients, which is obviously what we're all interested in. Okay, so we're just going to kind of get to know each other a little bit better first. So we've actually got 3 icebreakers to do that. The first one is a nice, easy one. I don't know if this is a good time to be asking this question, but we'll give it a go anyway. So what is your ideal holiday? So if you could just kind of type it into the chat function. If you are joining by phone, feel free to kind of chip in. I guess we've got the 3 options here, really, which is, are you more of a beach holiday person, kind of city break person, or more of a kind of walk in the mountains? But obviously you can choose another option as well. And we'll see what kind of people we've got, I guess, on the call. John's gone for C, mountains. Yeah, this is often a strong, yeah, it's coming through strongly, the mountains of the Q community. I think it's the combination, isn't it, of kind of reflection, but also action. Although, yeah, we've got a few coming through for the beach as well. And I can't blame anyone for fancying that at the moment. Great, okay, so we've got a bit of a mix. The next icebreaker is, where are you based in the UK? So, one of the Q community's real strengths is its diversity. So it's kind of geographic diversity across the UK. It's diversity in terms of the roles of members, so clinical roles and non-clinical roles. And it's diversity in terms of the organisations that they're working for, whether it's on the front line, academic members, voluntary sector, and even kind of public and patient representatives, although we are trying to strengthen that with a current partnership with National Voices. So yeah, please kind of chip in where you're from in the UK, and we'll see if we have got all the 4 corners covered. Lee, we've got Iona from Leeds, that's my hometown. Portsmouth, Scotland, Edinburgh, okay, so we've got a couple from north of the border. Southwest, East Midlands, Northeast. Got a few from Scotland, actually. Okay, so we're pretty well represented, although we're missing any representation from Wales or Northern Ireland on this call. Although actually, like I say, Q actually does have a really good kind of representation in those 2 countries. Fantastic. And then the third one is, yeah, a bit more of a question for you all, which is, I guess, what are you most excited about in Q? So just take a moment or so to kind of reflect on that, and then please do share your answer in the chat box. Great, thanks to everyone who's filling in their thoughts there. So perhaps unsurprisingly, a real emphasis on connections with, I guess, crucially, people who are facing the same challenges as you, but also kind of like-minded, in their experience and approach towards kind of improvement, as well as going beyond just connections and really kind of thinking about how we can kind of share learning and exchange methodologies and approaches with each other. So that's great. Okay, so without further ado, I'm going to hand over to the two members who we've got joining us, and we'll just hear for a few minutes about their experience of Q, and they'll be able to tell us a bit about their kind of journey since joining us. So I'm going to hand over to Andrew first. So just bear with us as we share Andrew's slides. And then Andrew, whenever you're ready, you just go for it.
Hopefully that's coming up.
Yeah, it's just it is coming up.
Well, it works better before.
It did on the test. Let's you're sharing your screen. Yeah, on mine it just looks like maybe can you close
Stop.
the
I'll give it another go.
gallery view. Let's give it another go. That's looking a lot better. Yeah.
Okay.
Fantastic.
So,
yeah, let's go for it.
There we go. So I'm Andrew. Gave you a quick introduction to myself earlier. So yes, I've been in Q about 3 years now, and quite pleased to be able to share my story with you today. So I was welcomed through Q with a Q Scotland event later in that same year. There were people from right across social and health and social care within the room, and came away from that event with a lot of enthusiasm and willingness to connect. Actually, from that meeting, I actually sat down with someone, a doctor that was local, trying to work their way through changing something within the hospital setting. And we were able to sit down and share thoughts and ideas. And she went away with a different approach, and actually did change the way in which some testing was happening in her in her unit. So that was my sort of first randomized cover trial. I haven't actually linked in with the wider RCT, which is something that I am looking to do in the future, but you'll learn more about that later. So one of the things that I've done, having joined Q, is join the special interest group, which is Ambulance Q. It was set up by Sarah Williamson from Northern Ireland Ambulance Service, and it started as a teleconference discussing and sharing ideas. We trialled a sort of cross-service education session for frontline staff, sharing knowledge and ideas, which was really well received by staff. We've also had opportunities to bid for funding through the Health Foundation. Sarah went on maternity leave, and I took the reins for a short while. We now share that role with Sarah back at work. And Ambulance Q has been really helpful in linking with wider work streams within the ambulance sector. Talking of funding, we did actually successfully bid for funding for which enabled us to host an Ambulance Q event. That enabled us to come together in Edinburgh, and then I was also invited to contribute to Project Day, and we had a number of people from NHS Horizons that joined us. So Helen Bevan came and presented at that event. The feedback from the day was really positive, and the outcomes were continued to grow from that. And actually, it was really clear even before the event started that people had benefited from coming together. We actually often use Zoom. We were able to link in with the licenses through Q and special interest groups, and that's been really good. And actually, we've really taken to that virtual interaction and that ability to share in a different way. If you're interested, we do have a link to a blog which is hosted by NHS Horizons, and you can have a look at it there. I presume that I'll leave that up for a second so that it goes. We also had the opportunity to bid for the Q Exchange, and last year we were successful in achieving £30,000 in funding, which is allowing us to continue to grow and share. So that Health Foundation support has been really integral with Ambulance Q. The main benefit for me are the connections and sharing, which is what a lot of people were keen and excited about. And these events that are being hosted by Q, those interactions with the wider health and social care system. They've recently set up an allied health professions, and we're looking in the future to be able to link with them. So there's an allied health professions special interest group, and they were really keen to learn from what we've done, and actually I think moving forward we'll have a lot of potential joint working that we can do. And that's me really, so thanks for listening.
That's great. Thanks so much, Andrew, for sharing your experience. So I think what we'll do is I'll hand over to Nikki now, and then if people have any kind of questions for either Andrew or Nikki, please just type them in and we'll try and get to them once Nikki's spoken. So that was great. Thanks very much, Andrew.
Hi. Okay, I'm going to share my screen now and hope this works out. Can everybody see that?
Yeah, that's great.
Yep. Can you see that, Matthew? Okay, that's great. All right. Okay, well, this is a Q and me, so a little bit of a story. Sorry, I'm just struggling to get the slide deck to move on. Maybe, there we are. That's okay. Right. So, welcome to the Q community. There's as many reasons for joining as there are people. And there's one thing that unites us all, which is the passion that we have for quality improvement in its many shapes and sizes, really, and a whole range of different methods that we can use. I've just been watching MasterChef recently, and I'm struck by a similar display of passion for quality that I see in both the people who participate in that and the Q community. So I'm just going to draw on that in a little while, or throughout, in fact. My own journey started over a decade ago now, working in the NHS and then with the NHS when I set up the Quality Improvement Clinic. When I started out, I knew far less about QI than you do now, but my interest was nurtured by people around me, some of them every day and others just from time to time. And it's the connections with these people that share the passion that I have that has allowed me to grow and to share my experience with other people too. These days, the Q community is a go-to network for me and for many of my colleagues. One of the innovations I really like is the randomized coffee trial, which Andrew alluded to as well. It's a pun on RCTs, of course, which those who are clinical would be very familiar with. And in Portsmouth, the QI team I've been working with over the past 6 months used RCTs to get to know people in other parts of the organisation. So not just people who are members of Q, but actually reaching out. And it's a great way to have conversations that span boundaries with people you wouldn't have had that type of conversation with before. It's a really simple thing that you can do anytime and anywhere. And last year I had a randomised controlled coffee trial, with Christina Bishan, who's the head of transformational change and improvement in Orkney. I was up there and I just thought, why not look her up? So back to MasterChef for a moment. Whilst marvelling at how the participants improve exponentially, I now understand that they actually have access to a host of training opportunities and resources behind the scenes that we're never shown. And it's like this with the Q community too, really. We have access to so many resources, people and learning opportunities that we can't fail to grow our skills and confidence and to use quality improvement even more as we're part of this group. An example similar to Andrew's, at the Clinical Human Factors Group, where I'm a trustee, we wanted to explore the expertise and interests and different perspectives of human factors and ergonomics in its application to patient safety. So last year we tapped into the special interest groups that exist within the Q community, and with them we co-designed and delivered a really brilliant session, creating even more connections and learning opportunities. So that was a really good experience for many people. Yet another parallel with MasterChef is the way that the participants are exposed to new cooking experiences and to people like they might never have met. So each year, Q members Pete Dudgeon and Emma Adams arrange a schedule of visits for us too. And these give us unprecedented access to organisations large and small in the public and private sector. It's a chance to hear personally from people who design, lead and deliver change on a daily basis. So I visited Health Improvement Scotland in Edinburgh and the Health and Safety Investigation Branch in Derby and the Unipart factory in Oxford. These are all places that reflect my personal interests. And there are so many others that I would love to have gone to as well, if only I had time. So a word on time. It's always in short supply. And for those who need something nearer to home, like right now, Q brings us the experts in other ways too. So they have a whole series of live web and recorded webinars, not just ones like this where we connect with other members, but with experts such as Trish Greenall, who did one last week on virtual consultations. And this afternoon, a whole group of experts talking about complexity, chaos and COVID-19. So you can't really get more current than that. Oh, I think I might just gone to the wrong slide. Can you still see me? Yeah?
Yeah, we can see you.
I'm not going to stop at the MasterChef analogy yet. I'm not a massive fan, but I do watch it. And the other analogy I wanted to have is that participants progress and you just see how much they're learning, but also you understand how much they are practicing and failing and learning even more before they actually present their offerings out to others. And that has some great parallels with quality improvement and the way we do small scale tests of change. At the same time, we also see how their confidence grows and their ability and their ambition. And I think that's something which I hope you'll experience through Q, is that it gives you that confidence to reach out and be even more. So learning from failure is a bit of a QI mantra, and so is learning from success. So in the past 2 years, I've worked with another Q member, Dr. Jane Runnicles, who you can see here on the right, of myself in the middle. And together and with a teaching faculty, we've developed a blended learning quality improvement programme for paediatric trainees in London. And we've used QI to guide the programme's development to date and delivered it to over 70 learners in 4 cohorts. But also, inspired and influenced by the Q community, amongst others, we offer free places to parent learners. And one of them has been so motivated by this, she's joining as a mentor to new parents who come on the programme. So we feel that's a real success. We're always learning, and now more than ever before, we're adapting to exceptional circumstances. So we have gone completely virtual for now at least. Q can be experimental too, and liberating, like this unconference shown on the right here that we had in Wessex. It was a chance to have a really informal opportunity to get to know Q members within our region and to get creative as well. So the Q community provides the glue, if you like, something that keeps us connected as we develop our lifelong QI habit. This is me here with my Pekka Kutcher presentation I did at a Q conference, perhaps the most scary public moment in my career, but it was made possible by the coaching and support from Q and the promise of a receptive audience. It's given me even more confidence to continue my journey teaching and coaching QI and encouraging others to share their journey too. So I'm really hoping in the future we hear some of you sharing your journey back with new members. As a Q member, you're in a great place to develop your own habit of lifelong learning that suits you. I hadn't really thought I had connected massively with Q until I started writing this presentation. And then what I realized is I've had a dipping into a whole range of things that they offer, and that's only a fraction. So pick and mix what works for you. It's up to you what you do with it, and reach out and explore and connect with other people, and take your first step, or your second step if this is your first step, to do even more. we'll be sending around a link for a free program that you can use if you want to have a go shortly. So that's the type of stuff I do, some online virtual social learning. So good luck, and hope to meet you personally sometime.
Fantastic. Thanks so much, Nikki. And to Andrew as well. It was really, really useful, I think, to hear, yeah, I guess, you know, from you directly about your kind of experience and journey with Q. Obviously, Andrew really seems to have made the most of it in terms of the specific area that he's working in around ambulance. But then equally, as Nikki said, you know, there's many different kind of pathways that you can navigate through Q. And it is a bit of a cliche, I guess, but obviously the more you kind of put into it, obviously the more you kind of going to get out of it. Not just in terms of time you put in, but I think especially for new members, it's really important to be kind of intentional about what is it that I want to get out of it, and then how can I make the most of the whole range and suite of kind of offers and resources to ensure that I'm getting what I need. Of course, it's not just about kind of what you get from the community. You know, the whole spirit and value of Q obviously is about that reciprocal nature, that people kind of, in some modes and times you might be giving more to other people, and then on others you'll be kind of taking more in terms of the learning that you're taking from those individuals, and that's all part of the kind of spirit of Q. Great. Okay, so I think what we'll do is we'll keep going, and then we'll pause a little bit at the end if people have got any more questions for myself, Andrew, or Nikki. So hopefully everyone can see the screen again. What I'm going to do is I'm just going to go through in a little bit more detail the different elements and offers within Q. So it'd be really useful for you all to be thinking when you're hearing this kind of, like I say, how can you make the most of Q, particularly over the, you know, your first few months and this year. Great. Okay. So this is an extract from our kind of theory of change. So obviously Q is here to support more effective improvement activity and, you know, ultimately lead to more sustainable and higher quality health and care. In a way, this section is how we think that, you know, what we do kind of achieves that change. So we've got these four kind of pillars that we use to kind of think about and structure some of our work. The importance of connecting people together, obviously that's first and foremost within the community. Supporting each other to learn and share and responding to people's kind of queries and questions. Obviously developing that learning both individually and collectively through a whole range of different offers. And then the fourth pillar, which, you know, is key really, is what we're all ultimately trying to achieve, is actually collaborating together, mobilizing to organize and spread those improvement activities. So actually put all those learnings and connections and support to use in terms of actually delivering improvement and action. So I will go through those four kind of in turn. I guess an important thing to stress is that often for members it's almost like the kind of dynamic interrelation between those four bits. So a bit like Andrew was kind of mapping out, you know, that he made a connection, but then he used that to kind of join a group of kind of relevance, which was more supportive. Then they put on a kind of development opportunity through the event. And it's how members, you kind of draw on the different elements of those four to then ultimately lead to that kind of collaboration. So the first one is around connecting. The way we've structured the slides is that I guess around each of these four, there's a kind of light touch engagement, a more medium kind of level of engagement, and then a much more substantial ways that you can kind of get involved around this. So around connecting, we've got the member directory where you can kind of easily search other members. You can filter by their kind of interests. A bit more substantial, both Nick and Andrew mentioned, were the randomized coffee trials. They're those kind of monthly, randomly assigned kind of calls with other members. I think they're a really, particularly for new members, they're actually a really good way of meeting and speaking to people who, you know, you wouldn't normally necessarily meet within your day-to-day work. And then obviously there's the more kind of substantial ways that people can connect, whether it's through the national annual event that we hold every November, or more kind of local events that are often held kind of throughout the year. Now, obviously the nature of those events will be changing in the current context, but obviously there are plans, like Nikki was saying, and we've already delivered a number of kind of online events and opportunities for people to connect around the response to COVID-19. So then the second pillar around kind of developing, like I say, it's that importance of learning both individually but also collectively with other members. Fairly light touch ways are the really kind of tightly and curated and useful resources that the Q Comms team send through. So that's Robin and her colleagues, whether it's the monthly newsletter or various other kind of resources that they email out to interested members. There's a whole suite of online resources that members have access to, IHI resources, BMJ quality, and other kind of resources that you can really make the most of that are available freely to members. And then in terms of, I guess, more substantial ways to kind of I think you can also get CP points for attending those. And they are very popular, so I would really encourage you to look out for those and sign up early. We do host them around the country, so yeah, do look out for them and try and sign up, because they often do get booked up. Offering some development opportunities around the direct response to COVID. So particularly in last week, we focused quite a lot on virtual consultations through the webinar with Tricia Greenhalgh, as well as providing a lot of kind of links to other existing resources around that. So we recognise the importance of kind of being responsive to the current context. Thirdly, then, the kind of support. So again, I think Nikki and Andrew mentioned this. The onus here is the importance of supporting each other, I guess. And that's part of the kind of spirit and value of Q. I think when thinking about how we can access most kind of meaningfully and usefully access support from the community, it's whatever form you're doing that in, it's really important to think about the kind of ask. So what is it really that I need? Making sure you're asking the right people for the right kind of things, and that can really help them then in terms of responding to that kind of ask. So that could be an ask on kind of social media. You know, we're very active with members and non-members, obviously through Twitter and other social media. You could obviously share some of your learning more substantially in a blog or a news item on the website, and crucially use those to actually ask for additional support. You know, that's how a lot of people frame those kind of reflective blogs. And then there's the opportunity, obviously, to get a bit more substantially involved in supporting with peer groups around specific special interests. So we've got the special interest groups set up. There's a whole range of them set up there for people who, like I say, are interested in a particular topic or a particular kind of theme. If there is something that you think would be a really useful group that isn't there, you know, we'd encourage you to set it up. It's all about kind of members taking that ownership around self-sustaining the community and getting what they want from it if it's not giving you specifically what you need. And then fourthly and finally, in terms of collaboration. So like I say, this is obviously what we're all about, isn't it? It's about putting all of this stuff kind of into practice, you know, working together, and like I say, putting it actually into improvement activity. So we've got a whole range of kind of tools for collaboration that can help you, including creative approaches to problem solving, liberating structures have proved particularly kind of popular with members. So you have kind of access to some of those resources about how you can collaborate more meaningfully and usefully with members, but also kind of non-members, you know, those people who you work with anyway within your organizations. And then I guess around the collaboration, we've actually got two more kind of substantial programs. So the first is the Q Exchange funding program, which you may have heard of. So this is a pioneering small grants program of 30K. Project teams are set up from, crucially, the community itself has a role in not just voting for the successful projects, but also helping them inform and shape and develop those ideas before they actually go to the voting. So it's a real kind of pioneering approach. We've done 2 full rounds of that, and we will be doing another in this financial year as well. And the second more substantial opportunity for collaboration is some of the Q Labs work. So again, you may be familiar with this. The Q Labs is a distinctive approach to kind of tackling complex challenges and bringing the key people, I guess, together that can tackle some of those really, complex and kind of persistent challenges that are faced within health and care. And the idea there is that you work kind of in depth over a 12-month period to really come up with the solutions and trial and test some of those potential solutions. They're a fantastic way of actually developing a lot of skills and capability in some of those more, I guess, innovative approaches, particularly drawing on kind of service design and other innovative methods to try and crack some of those persistent challenges. Okay, so that was a bit of a whistle-stop tour around the kind of resources and offers. Like I say, we're really encouraging you to think there about, yes, how can I really get involved then?